On a popular demand, many people were requesting for me to do a video about healthcare in Malta. And there is no better way than having an actual doctor who lives here in Malta, and it's not Maltese. So this is a video that is going to be quite an eye-opener for people who are also coming from abroad and they would like to live in Malta. James, welcome.
Thank you, Alex.
Thank you so much for being here.
Thank you for having me.
We know each other many years. I think over 4 or 5 years now.
From COVID.
From COVID time, yes. I'm happy that you're a guest of mine. I want people first to get to know who you are, and then they're going to get the story and professional information about the healthcare. Tell us something about yourself.
Right, my name is James. I'm a doctor. I'm originally from Ghana. I'm born and raised in Ghana. I was trained in China. So yes, I know the next question. Do you speak Chinese? Yes, I do. I speak Chinese.
You speak Chinese?
Yeah.
I didn't know this about you,
well,
really?
Now you know. So yeah, 你好，我叫君南，我是医生，我是沈阳医学院的学生，我现在在马耳他。
谢谢你。
Yeah. That's Chinese. That's thank you.
That's all I know.
So but I live in Malta now, and I work in St. Julian's.
Yes. Where we are filming right
now.
now.
Where we're filming right now.
And the clinic is just behind us,
yes,
which we're going to show it to
over there. I work in Spinola Clinic, and I work in Patcherville as well. I work with Dr. Navarro Gera. So we
a huge shout out to Dr. Navarro. Yes. I know you're going to watch this. Thank you.
Dr. Navarro Gera is my boss, and I met Alex through Dr. Navarro Gera.
Yeah, I know Dr. Navarro since 10 years ago, since I moved to Malta as well.
Fantastic, yeah. So we work in the St. Julian's and St. Julian's Bay area, providing healthcare, and we run few clinics in this area.
We are going to give quite a lot of information for my audience today, and also where they can find you and all the services. We are coming to that part later on. But I just wanted us to have a bit of an introduction about the healthcare, since you are in it. How would you describe the Malta's healthcare system to someone who is not familiar with it?
Okay, so essentially the Maltese healthcare system is one of the most efficient healthcare systems which I have seen. There are two major systems which everyone has to know. There's the private healthcare and there's the public healthcare. So the public healthcare, you have the health centers which are scattered across the island, and you have Malta Day Hospital, you have Paula Health Center, Monster Health Center, Floriana, and a few other barges across the island, where you can go in and access healthcare when you live here. With the private healthcare systems, you have a lot of private GPs around, private clinics scattered around like ours. And then you've got private hospitals as well on the island where you can go and seek healthcare.
This was my second question that I prepared for you. How easy it is for residents and people coming over to Malta to enter into the healthcare system?
So that is a twofold question. If you want to access healthcare, it's one thing. And if you want to be into the healthcare system, it's another thing. What do I mean? If you just need to see a doctor, that's to access healthcare, that's one thing. Most doctors operate in clinics or even in the pharmacies where you can find a doctor, and there are a lot of walk-in clinics, like Spinola Clinic where we work is a walk-in clinic. So it's opened every day, for example, from 9 till 7. So you can walk in any time, and then you'd be seen by a doctor, either myself, Dr. Navarro,
from 9 a.m.
till 7 p.m. And we have other doctors as well who come in. And then there are other clinics where you have to book an appointment. In most cases, you would get an appointment same day or next day. It depends on the schedule of the clinics which you are requesting. But most people should be able to see a doctor on the same day. In fact, in most clinics, like say you want to see me now, and you just ring in. You can just come in and you'll be seen in 10 minutes.
That's what
in 5
me
minutes.
and my friends, they always do.
Yes, that's what you always do.
James, I have my next question for you. What is the biggest challenge for you as a doctor here in Malta in the healthcare system?
As a doctor generally, or as a foreign doctor?
Let's say as a foreign doctor. I think that would be nicer.
Yes, exactly. So I think Malta is actually a very cosmopolitan place. You know, it's a very small island, but you have people from all over the world. Yeah, you have people from Hawaii all the way to Russia, South Korea. You have people from everywhere, and the attitude of healthcare in different parts of the world are completely different. So people see healthcare differently. People approach healthcare differently. And so a lot of times there are people who come in with some different expectations, and that they may see things very different, and that becomes another challenge to try and you know, explain and explain and explain. And also there's the barrier of language, because different people speak different language. But for us, Dr. Navarro Ruggiero speaks English, he speaks Italian, he speaks German, he speaks Maltese.
Of course.
I speak English, I speak Chinese, I understand French.
You understand Maltese?
Yes, yes. Yina bil Malti ftit, mux ħafna.
Multilingual.
Yeah. Yeah, so
Wow.
we try to accommodate people as much as we can.
There is a question that a lot of expats are asking when they're moving to Malta, when they start working, about insurance, private healthcare insurance, and just entering in a private hospital, in a public hospital, all of this. Can you just break it down for me and the audience? How does this exactly work?
So by law, all EU citizens are entitled to free healthcare in Malta. But it's only
Free healthcare
free
in public.
healthcare in public institutions in Malta. All people who live and work in Malta and have Maltese residence permits, pay taxes here and are enrolled in the National Social Security also have access to this free healthcare, which is only in the public sector. Okay. So if you go to the polyclinics or you go to Malta Day, you will get free healthcare. That's established. On the other hand, if you go to a private hospital or you go to a private doctor like myself, you have to pay for the service. But most people have private insurances. These insurances are accepted in all clinics and also accepted in all hospitals. So basically what you have to do is you go in, you get your insurance papers, the claim forms, you get seen, you pay for it, you get a receipt, and your insurance would pay you back. On the other, that's the easiest way to do it. On the other hand, there are some insurance companies who would tell you to phone them up, and then they would communicate with us, send us a guarantee of payment, which is a legal document, and then you will be seen free.
Okay.
It's not free. Your insurance will pay for it, but yeah. So most insurance companies, I know most people who work here are enrolled with insurance companies like Atlas, Bupa, Mapfre, Gazan Mamo, all the others. You don't worry about it at all. You can just walk into any clinic. You can just come to our clinic. We'll see you, and then we'll do the paperwork.
Speaking about this, I think it's time for us to go inside your clinic,
Yeah,
and we can continue with a few more questions there.
Yes, please. Sure.
Let's go. So excited people will see exactly where the clinic is, in the middle of Spinola. It's very easy.
And it's actually a very nice spot. You know, you have this lovely view here.
You have a lot of walk-ins, especially in summertime when there are the tourists in Malta.
Yes, in fact, a lot of people just drop by. You can just drop in any time and you'd be seen within the shortest possible time. There are people who literally walk in and get seen in the next 2 minutes.
I know.
Yeah.
I experienced that twice.
Yes, when you were, I mean, yes.
I mean, I should experience zero waiting time.
Yes.
So
you know that. So yeah, it's very easy to find. Also the location makes it a good spot for us. Here you've got the McDonald's, you have the police station. So
this video is brought to you by McDonald's.
Oh yeah, so you get a sponsorship from McDonald's. And you have all these coffee shops and nice places to eat here, you know.
So you can come and do your STD test, and while you're waiting for the result, come here for a glass of wine.
Yeah, or else after you get an injection, and you know, when we were kids, they used to give you an injection and then they'll buy you a candy. Yeah. So you get an injection and then you buy, I don't know.
I got my injection in your clinic before I go to Thailand last year.
Yes, the vaccination.
So these are some of the services that you provide, and now inside your clinic we're going to speak about other services that you provide people here.
Yeah, sure. Come with me.
Welcoming. We're inside the clinic now. Very simple, very easy people to find it. They can even just drop off at the bus stop and they will find the clinic straight away. Once they find the clinic, what are the services they can expect from you?
Right,
what do we do here?
Essentially we're doctors, okay? So the first thing we do, we look after sick people. So we treat all forms of sicknesses, and that's the beauty of what we do. We are mainly diagnosticians, so we focus in diagnosing things, especially in the acute setting, which is things which start off, you know, so you wake up, there's something wrong, you don't know what it is, you come. We have a lot of testing devices available in our room. We take your blood, we run some tests, we do ECGs, we do blood tests, so we check for your normal blood counts, we do liver function tests, kidney functions, we do testosterone tests, you know, lipid profile to check cholesterol, all this kind of stuff. We do STD tests, okay, which is a very interesting thing because To be honest, there are a lot of people walking about who may have some conditions which are easily treatable, but then they do not know about it. Also because they don't know where to start from or where to get tested. You come to us, you get a test, and these are very quick point of care tests, and so you get your results in a very shortest possible time, and then we tell you the due procedure to do from there. We also have health screenings where we do vaccinations for work permits. So all foreigners, all non-EU nationals who live and work in Malta need to go through a prerequisite health screening, which we do. So you have to take some vaccines. We need to check and make sure you're fine. We need to make sure you're safe, so we can keep everyone safe on the island. We do that so you can get your work permits from Identity Malta. We do screenings for driving licenses. So before you can be approved for a driving test, you need to go through a testing thing, which is mainly now done online, you know. So we do that service as well. And then we do vaccinations for travels, like what we came to do. Yeah, people want to go to Thailand, people want to go to Brazil, they want to go somewhere else to enjoy. You come, we have a travel clinic. So you come, we check what you need, and we check your records. We give you the vaccines, we administer them, we do all the paperwork for you. And generally, when something cuts you or when you get hurt or stuff like that, you can come, we stitch you up. So we do minor procedures, you know, and we fix people.
Nice. Wow. James, thank you so much for taking the time to provide with all of this information. I don't know if you missed out on any other services that you do.
Well, there are many people who live here, who work here, because this area is a hotspot for working.
Yeah,
when you are, yes, St. Julian's, people work in St. Julian's. When you are sick, for example, you need to go to a doctor for you to be seen and for the doctor to certify you that you are sick, and so you're sick for this day and this day, and you cannot go to work and stuff like that. A lot of people don't know where to go. A lot of people don't know where to find doctors, but that reason does not hold anymore, because now people know where to come. People know where to find us. We are always here. Our doors are open from Monday till Saturday, 9 a.m. till 7 p.m. and also on Sundays and on public holidays.
I was about to ask you, Sunday and public holidays.
Yes, we are the only clinic in the area which is open on weekends, on Sundays and on public holidays.
What are the timings on Sunday and public holidays?
10 o'clock till 12 o'clock.
10 till 12?
Yeah.
For 2 hours?
For 2 hours.
Okay, yeah, better than nothing, of course.
Of course, of course.
Wow.
To be honest, on a Sunday, if you need a doctor, you need it in the morning. When you wake up, that's when you realize you need a doctor.
Recovery.
Yes, recovery after a Saturday out.
Wow.
So yes.
Do you have any message for anyone that is watching this video right now? Something to close off the topic.
I mean, health is wealth. That's what I can say. Health is wealth. So we need to look after ourselves. If we are not healthy, we have nothing.
And thank you so much for you being part of the
Thanks,
healthcare
Alex.
system here.
Sure, we should meet for a coffee sometime.
Yeah, of course, and we'll do a part 2. Guys,
yes,
if you have any further question about the healthcare system in Malta, James is going to be here in the comment section as well, and we are going to answer them.
Sure. Thank you.
It's
a pleasure having you.
Thank you.
Thank you for having me, Alex.
Here we are coming to the end of the video, guys. Thank you so much to Dr. Navarro and Dr. James for being here in today's video to give you all the valuable information about the healthcare in Malta. That was so sweet. If you guys enjoyed this video, please make sure to like it down below and don't forget to subscribe to my YouTube channel. Until I see you in my next one. Bye.